Hi, everyone, and welcome to today's LinkedIn Live. So we get two this week. Super excited about that because I couldn't wait to speak with today's guest, Jason Gorevic, who is the CEO and member of the board for Teledoc Health. And the name, I think, of the company sort of describes it all, but they're the world leader in whole person virtual care, a company with more than 5,000 employees, and revenues, interestingly, are larger. Their revenues are larger than their next five competitors combined. So definitely the elephant in the space. They had revenue in 2022, so our last full fiscal year, of 2.4 billion. That was an increase of 18%. So large company growing at a healthy clip. Thank you so much for joining us today, Jason.
Well, thanks, Karen. I appreciate it. Thanks for having me on, and that's a warm introduction. So I'm excited to get started.
Thank you. Well, like many people, I'm thrilled to be able to have hybrid care in my life. So looking forward to hearing more about this space. So maybe you could start by just telling us a little more about Teladoc, sort of your mission as a company, the problem you're trying to solve for.
Yeah, so I appreciate your teeing it up like that. We, as you said, we're the leader in whole person virtual care. What that means is that we deliver the full gamut of healthcare, ranging from everything from urgent care on a virtual basis to mental health care to care for people living with chronic conditions and expert medical opinions for those who have complex situations. We do that globally. So we have business all around the world. Probably about 15%, maybe 20 comes from outside the US. We serve about 90 million people who have access to our platform. And so to your point, I think scale really matters in delivering virtual care at the highest quality that's available. And the reason is because we can take care of people using the largest trove of data and constantly improve not only the consumer experience, but the quality of the healthcare that's delivered. And we find that ultimately that yields better clinical outcomes, a superior consumer experience, and lower cost, which everyone needs from a healthcare system that's out of control with respect to the cost of care.
Yeah, 100%. I think anything that can improve on our current system, particularly for people who don't have the means to sort of pay extra for concierge and that sort of thing, is just vital to the health of our country. And appreciate that you're global and supporting people who are in other healthcare systems as well. So you've been at Teladoc as CEO since 2009. So congrats on your long tenure. I want to hear a little bit more about that in a bit, but maybe you could tell us about the evolution of Teladoc during that time. I mean, I can imagine that 15 years ago, it was a very different company than it is today. How does it compare to what's happening today?
Yeah, there's no question. I mean, 2009, I look back occasionally and it's eye-opening to me that 2 years before was when the iPhone was first released, right? And so like we think about what virtual care is today and how prevalent it is and how it's part of everyone's vernacular. And at that time, it was brand new. So, I always say if I were an investor, fortunately, I'm not an investor, but if I were, I'd be a macro trend investor. And at the time, I really thought that all the trends were lining up behind virtual care as an opportunity. Telemedicine at the time, it was mostly called or e-care or something like that. Telehealth was more of a promise than a reality back in 2009. But I really thought, and we'll probably get into my career, but I had done a lot of things over the course of my career that led me to believe that not only was this the right time, but that I could really make it work. And I had a bunch of experiences that led me to that conclusion and that decision. I will say it took longer than I thought it was going to take. I would talk to my friends about it and they'd be like, can you really do that? Is that real healthcare? Is that legal? I remember the announcement went out about me joining the organization, and I got literally condolence notes from people in the industry who said, I thought things were going so well for you. If it doesn't work out, maybe I can help you. And of course, we were really doing telephonic urgent care at the time. And so from there to being really able to take care of the whole person as we do today, both mentally and physically, has been a long and very deliberate journey. But it's one that I think is not only yielding benefit for our members, but also has created tremendous differentiation for the company.
Yeah. Well, I'm just thinking, you mentioned iPhones. I think it's fascinating we still call them phones, right? Which is maybe the least thing that I use that device for. And online or virtual health is sort of the same way. I imagine that what you were able to do. I mean, you know, I think about Amazon, right? When I buy books, obviously. And then it was like, oh, you should buy something else from Amazon. It's like, no, I'm not going to buy anything else from Amazon. They're a book company. But now, like many people, I think my life is powered by the packages that show up at the front door once a week. So as Teledoc grew, so at some point you got some traction. I'm imagining that the pandemic, when we were unable to see our doctors and our healthcare providers face to face, was sort of a turbo boost for that. Yeah, can you talk about maybe the growth trajectory over this time?
Yeah, there's no question. I mean, I look back at our revenues, and 19, 20, 21 went something like 550 million, 1.1 billion, 1.5 billion, right? Like that's an insane growth trajectory. And there's no question that the pandemic was a turbocharge for us. And at the time I remember feeling some mix of emotions around gratitude that we could be there for people when they really needed us, validation that the work that we had put in was really yielding benefit and resulting in the kind of impact that we thought it could have, but also a bit of terror. I was terrified that we wouldn't be able to meet the demand and have enough capacity to deliver on our mission and really be there for our members and our clients. And it was a time of tremendous innovation for the company. We had to essentially remake a lot of our processes and infrastructure to be able to scale, not over the course of years as you would normally, but literally over the course of days. And it was a time, and I continue to be tremendously proud of the organization and the people who stepped up to that challenge. It also forced us to expand much more rapidly the scope of services than we likely would have. I think we would have gotten to the same place, but it would have taken us a lot longer, and it accelerated. I always say it accelerated the maturity curve of our business by somewhere in the neighborhood of probably 4 or 5 years.
Yeah. Yeah, I mean, both in terms of what you were able to offer, needed to offer, but also the general public's acceptance, right? In fact, we were pulling to get those kinds of services. So what a place to be. You and I haven't had much conversation before this, but I was part of the leadership team at what was then the fastest growing company in American history, if you remember, Compaq Computer. And it was the same thing. We just didn't know, right? If you'd known, oh, we're going to grow by 50% this year and 50% again the year after that, you would put structures in place to be able to deal with that. But in your case, as well as what I lived through, it was like, just, what can you do to sort of keep your head above water and continue to deliver? And in the case of healthcare, it's one thing if you ship a computer and something's not quite working right. But if you're delivering healthcare services, the onus on getting it right the consequences are so much bigger.
It's 100% true. And that was the tension, right? How can we meet the demand and do it in a high quality way? Because meeting the demand without that quality can be really disastrous. And so for us, quality has always been top of the pyramid in terms of requirements. And I think you're exactly right. People underestimate how challenging healthcare is and the consequences of getting it wrong. And so, I hear about new competitors or new entrants into the market who maybe have been successful in other businesses, but healthcare is not really their primary or only focus. And I always think they probably don't really understand the complexity and the consequences of getting it right.
Yeah. Well, hopefully it will be a short learning curve for everyone because, again, of the consequences. So that's kind of the history of Teledoc. Maybe you could talk a bit about where you are today. I know I hear words or researched words like unified app. And I know earlier this year you introduced, I think, what are loosely called cardiometabolic care practices, particularly on GLP drugs. So maybe you could talk a little bit about what's going on today and sort of where you see Teladoc in the industry going.
Yeah, so as I said, we started really with virtual urgent care. That was the entry point that enabled us to get to scale, to serve millions of people, to be able to work with the largest health plans and employers in the country, um, and then created a foothold and a pattern of engagement from our consumers such that we could expand the scope of our services. And so today, not only do we continue to do virtual urgent care, but we take care of people with virtual mental health care such that they can access care for what is otherwise a really difficult system to avail oneself of, something that has still very significant stigma associated with getting mental health care, and really is difficult to navigate and find the right therapist who's right for you. We also then bring that mental health care into our chronic care management, which is things like people living with diabetes or hypertension or pre-diabetic and potentially dealing with weight issues and other metabolic issues. And when you think about the challenges associated with somebody managing those, it's not just managing your sugars, it's managing your motivation to change your behaviors, right? And so it's really important to understand how all those things hang together and take care of the whole person. So when we talk about whole person care, it's not just a moniker. It's like it's a real philosophy and an approach to how we take care of people for everything they're dealing with in their lives. So we have about 1 million people, over 1 million people now enrolled in our chronic care management programs. We deliver somewhere in the neighborhood of 30,000 virtual visits a day. We take care of literally hundreds of thousands of people, probably millions now, for their mental health care issues. And we're there for people 24/7, 365, delivering both the technology as well as the clinical resources to take care of them.
And where do you see the industry going, and anything specific you want to share about Teledoc in the future?
Yeah, I really, people ask me sometimes like, hey, what will I be surprised about 5 years from now? And my answer is actually, when you ask people 5 years from now where they get their healthcare, you'll be surprised at how many people just say Teladoc Health, right? Not where do I get my diabetes care, or where do you go for virtual urgent care in the middle of the night, or where do you go for your virtual mental health care, but just where do you get your health care? Like, who do you go to? And I think the opportunity for us is to continue to expand the scope of clinical services we can deliver, integrate with the physical delivery system for people who really need to be seen in person, such that we can make the right referral the first time, because we don't have entanglements, whether financial or social or otherwise, with anybody else in the physical delivery system, and be essentially somebody's medical home. And I think that's really what will continue to shift over the long term. And I don't think that's, I've been here 15 years. It's not going to be another 15 years until that happens. I think we're moving rapidly in that direction.
Okay, well, I look forward to seeing how all that develops. I know I have a hybrid care myself now, and I couldn't imagine how that was going to work 5 years ago. Never mind 15. So great that you did. So let's shift now a little bit to you and your leadership. You mentioned earlier sort of the mega trends, and how did you choose Teledoc when you came on in 2009?
So I've spent most of my career in healthcare. I came out of college and went into a managed care company. I took about 5 years out of healthcare in the middle of my career to do more tech-oriented startups, and then went back into healthcare. I was the president of Empire Blue Cross Blue Shield. We were in New York. We were acquired by, at that time it was called WellPoint, and then it was called Anthem, and now it's called Elevent. And I spent about 2.5 years there. I became the chief marketing and product officer there. And I didn't love working for a really, really big company that was, I think, 60,000 people at the time. I also felt like it wasn't mission oriented enough for me. The reason I went into healthcare in the beginning was because I wanted to make a difference and apply my career towards something that I thought could really be valuable for people in a way that really matters. And so I left WellPoint in 2008. I took a year off to essentially recharge and figure out what I wanted to do next. And so my kids were little, and I spent a lot of time with them, and I think that may be the best version of myself. And then I just was deciding, quite frankly, between going back and running a big health insurance company and going to this little tiny startup. Teledoc at the time was doing about $4 million in revenue. It was essentially a restart. It was in $2 million in debt to the Series B investor, had about 30 people. And I honestly, I felt it was a question of, where can I make the biggest difference? And do I believe in this space? And, it was a bit of a risk. There's no question. I was really fortunate. My wife had a great job. And so I was in a position where I could take that risk, and we could take that risk together. And that's how I landed here.
Oh, wow. So I just want to pull a little bit on that thread of being able to take a risk, because so many people feel like they don't have choices. There's importance in being thoughtful about your next position beyond the financial rewards. I think you sound like you're a great example of that. So I think the average tenure of a CEO today is like 3 years. It's quite short. And you've been in this position now for 15 years and counting. How have you changed and developed as a CEO over this time period?
Well, I had a lot more hair when I started. I think, first of all, I benefited coming into the role of having experience at both really small companies. One of my companies I started up myself, so I was employee number one. But I had experience at startups, early stage companies, but also at big companies that were established. And I learned early the importance of line management and people management, and the difference between accomplishing something yourself on your own sort of force of will and intellect versus the scalability and leverage you get out of working with a team and managing a team to be able to accomplish something much bigger and broader than you could possibly do yourself. So, the evolution was, quite frankly, at the beginning, we had 30 people. I was doing a lot more of that heavy lifting myself. And over time, have worked through the evolution to leverage a team of people who I tend to believe in the management philosophy of playing to people's strengths. And so if we can have a team with people who have complementary strengths and put them in roles where we can maximize the output that we get from those strengths, then that yields not only the best result, but the best teamwork, because people rely on each other for complementary skills. And so over time, it's shifted from me doing the work myself to working with the team and relying on them. And I play more of a role of setting the vision, putting the right people in place, and ensuring people understand their role in the overall mission and how we accomplish those goals.
Yeah, which is not something you get to do once a year and set it and forget it, right? I'm wondering, I mean, it's a big company, right? I think it's in excess of 5,000 employees. You're global. How do you keep the team aligned? I think that's one of the biggest issues in companies that are growing really fast, particularly when we're not all in the same office together.
Yeah. I think we're very fortunate because we have such a clear mission. And so I think it's much harder for companies who don't have such a very clear mission, because ultimately, if your mission is really clear and everybody's very committed to that mission, you find that they make decisions every day that are aligned, like fundamentally working toward that mission. we do a lot with respect to communication. I remember when we went, you asked about the pandemic earlier. I remember when we all went home in February or March of 2020, we literally had daily meetings. So my whole leadership team would get on a video conference on every day, every single day. Now we've backed off of that to where we still do it 2 days a week. So 2 days a week, I get my leadership team together, regardless of what's going on. And it doesn't have to be a structured agenda. Sometimes we have structured items on the agenda, but a lot of times it's just sharing of challenges that we're dealing with or problems that we need to solve together or opportunities that we see in front of us. And I think that communication, even in a casual way, makes for an aligned team. And it also fosters culture. I can't really talk about my leadership without talking about the importance of culture. Everybody says it. I'm super proud of our culture. We're very deliberate about it. And it is very collaborative. I've always been, it's part of what I didn't like of being in a very big company. When I say very big, 60, 70,000 people, it leaves a lot of room for politics and alternative agendas to creep in. And I think by creating a strong mission, an aligned team that operates off of a common culture grounded in collaboration and collegiality, it really doesn't leave any room for politics and alternative agendas.
Yeah. That also tells me your team is good at resolving conflict, in part because you're clear about your mission, you're clear about each other's strengths, your swim lanes, and yet you're collaborative in solving problems. Because we have conflicts, and in high growth companies, you have them even more than in slower growth ones. So there's a tell there that's happening.
Yeah, you're exactly right. And when I say we're deliberate about it, we actually worked with an outside firm to design a specific program that we call Connected Leadership, that's based on the principles of dialectical behavioral therapy. Mm-hmm. And so we've worked really hard. We've taken something like 700 people through that program, which is about an 8-week program, to learn things like interpersonal effectiveness, mm-hmm. and dialectics, which of course is, you can have two things that are opposed and both can be true, and understanding and acknowledging and validating that in someone else, which enables for healthy and productive conflict as opposed to destructive conflict where people dig in their heels.
Yeah, because you're going to have it. It is a natural part of two human beings being in relationship with each other. So I love to hear that you've proactively gone into that. My last question, Jason, has to do with sort of the history of your leadership growth. The tagline for my business is up and to the right, because that's the spot on the 2x2 matrix where we always want to be. Was there a moment or an event in your career when you knew from a leadership perspective that you were moving in that direction, that you'd be successful?
It's an interesting question. I think I'm thinking about up and to the right, and up and to the right requires a consistent set of data points, right? In order to keep going in that way, as opposed to a single inflection. What I'll say is, early in my career, I got great guidance, which is, Jason, you can take on a really important high-profile role that was working for a senior executive in my mid-20s in a prime role that only the top MBAs would get. I never actually went for my MBA. And I said, I was offered that, but the guidance I got was, or you can go take this line management job. And I had designed a nurse advice line early in my career. I designed it. I went through the build. We did the pilot, and I was sort of coming back saying, okay, what's my next project? And the alternative and the advice I got was, you're going to need line management experience at some point in your career. I'm going to let you go run this thing with hundreds of nurses working in a call center and a very complicated business that had not only intellectual challenges, but management and leadership challenges. And so the advice I got was, I think you should probably do that, because the earlier in your career you get that experience and expertise, the better you're going to be. Now, Karen, I just want to be clear, I failed. So I was literally called into my boss's office and told, look, you're not doing a good job. You're not communicating. You're not bringing the team along with you. Remember what I said about what you can do by yourself versus what you can do with a team? And I was sent to remedial leadership school. So I was sent to a week-long course. And oddly, the same behavior came out in that week-long course where I knew the answer, but I didn't bring my team with me along. But that was tremendous learning that gave me self-awareness, insight, and the opportunity early in my career to really understand what it takes to be successful. And so for me, I don't know if that was the beginning of what was then a series of points of increasing responsibility and success over the course of my career. And that's why I actually, when we started talking today, that's what I talked about, right? Which was you can only accomplish so much on your own without bringing your whole team along with you and relying on a set of people with complementary skills and strengths.
Yeah. Wow. What an important learning. And I hope everyone can hear this, right? This is a clip that we will replay because I had a moment of my own early in my career with this. And I have on my desk, coincidentally, Amy Edmondson's new book, The Right Kind of Wrong, The Science of Failing Well, which just got the Financial Times Business Book of the Year. And I'm going to speak to her on the 19th of this month. But that's it, right? You need to fail early, learn from it. And for many people, it's, I don't want to, but I can't carry it all on my shoulders in order to be successful. So thank you so much, Jason, for sharing that with us. Really, really helpful. So our time has sadly come to a close, but I just want to say thank you again for being here and wishing you and your team at Teledoc all the best.
Thank you, Karen. I really enjoyed the conversation. Thanks for having me on.
Thanks.